Have you ever felt nervous or anxious whenever you speak in public? Or when you're facing fear like oceans or roller coaster? Well, I'm sure every one of us must have ever felt this feeling before, especially when they are facing something that is scary for them. However, how severe this feeling is and how they overcome it what make it different. Next. An excessive feeling of nervousness could become a sign, an indication of mental illness. And I'm sure most of us have already familiar about this disorder before because it was everywhere. What do you think the name of this disorder? I think most of us have already heard about this disorder before. Next. Yes, correct. In its anxiety disorder. In this opportunity, our group will inform to you all about anxiety disorder. But before we start, let me introduce the members of our group first. Next. Next. So our group consists of 6 persons. The first one is me, myself, Nitya Kirana Dewi, and the next one is Christina Sari, and there is Maria Bernis, Marta Esther, Mutiara Jasmine, and the last one is Nabila Kirana. 6 of us are students from Psychology Department at 11 Maret University, and we are interested to talk about anxiety disorder because we feel there are a lot of misconceptions between anxiety and anxiety disorder, and we wanted to inform to you all about the difference between both of it and talk further more about anxiety disorder. Next. So anxiety is a feeling of unease, such as worry, fear, or dread that can be mild or severe. Meanwhile, anxiety disorder is a type of mental health condition that involves persistent and excessive worry that interferes with our daily activity.
Okay, well, the next part is anxiety disorder can be experienced by anyone, but when this condition occurs, sufferers generally cannot explain why they feel anxious or worry excessively. Anxiety is a disorder that could harm someone physically and mentally. Therefore, understanding its symptoms and how to overcome it is necessary. Next. Okay, so the topics that we are going to discuss today: one, what the disorder means, its symptoms and characteristics about the disorder; two, the effect of the disorder, its impact and its influence on the people who are diagnosed with the disorder; and last, how to treat the disorder. Next. Okay, this is the part that we will discuss. One, overview of anxiety disorder. Two, effects of anxiety disorder, and last, treatment for anxiety disorder. Next, what are the causes and symptoms of anxiety disorder? However, the exact cause of anxiety disorder is not known. However, there are several factors that may be the cause of anxiety disorder, including 1. Genetic and biology. Anxiety disorder can run in families. Besides genetics, other possible causes are hormonal imbalance or irregular brain signals. 2. Certain medical conditions. Sometimes anxiety disorder are symptoms of certain medical conditions. Some medical conditions that can be triggers are diabetes, thyroid disorder, heart problems, respiratory problems, and so on. Next, 3. Certain drugs. Certain medication can cause anxiety disorder. In addition, the use of narcotics and alcohol can also cause an exacerbate anxiety disorder. And last one, trauma and stress. Individuals who have been traumatized, abused, or witnessed a traumatic event in their childhood are prone to developing anxiety disorder. Severe and prolonged stress can also make a person susceptible to this condition. For the next matter, for the next material will be continued by my friend.
Okay, symptoms of anxiety disorder. They are common symptoms of anxiety disorder. Tell us how to reduce anxiety naturally and when to seek professional help. There are any 10 symptoms of anxiety disorder: excessive worrying, feeling agitated, restlessness, fatigue, difficulty concentrating, irritability, tense muscles, trouble falling or staying asleep, panic attack, and the loss of avoiding social situation. Next. Okay, number one, excessive worrying. People with anxiety disorder will worry disproportionately about even or everyday situations. The worrying must also be severe and intrusive, making it difficult to concentrate and accomplish daily tasks. Number two, feeling agitated. When someone is feeling anxious, part of their sympathetic nervous system goes into overdrive. This kicks off effects throughout the body, such as racing pulse, sweaty palms, shaky hands, dry mouth. The symptoms occur because your brain believes you've sensed danger and it's preparing your body to react to the threat. While this effect will be helpful in the case of the true threats, they can be debilitating if the fear is all in your head. The next. Number three, restlessness. When someone is experiencing restlessness, they often describe it as feeling on edge or having an uncomfortable urge or to move. Number four, fatigue. These symptoms can be surprising to some as anxiety is commonly associated with hyperactivity or arousal. For some, fatigue can follow an anxiety attack, while others might feel fatigue almost all the time. Next.
And the next symptoms is difficulty concentrating. Some studies show that anxiety interrupts working memory, which is responsible for holding short-term information. This may help explain the dramatic decrease in performance people often experience during periods of high anxiety. However, difficulty concentrating can also be a symptom of other medical conditions, such as ADHD or attention deficit hyperactivity disorder or depression. So, difficulty concentrating is not enough evidence to diagnose an anxiety disorder. And the next symptoms is irritability. Most people with anxiety disorder also experience excessive irritability. Next. And the next symptoms is tense muscles. It's possible that muscle tenseness itself increases feeling of anxiety, but it's also possible that anxiety leads to increased muscle intenseness, or a third factor could cause both. And the next one is trouble falling or staying asleep. People with anxiety disorder may find themselves waking up in the middle of the night and having trouble falling asleep. While insomnia and anxiety are strongly linked, it is unclear whether insomnia leads to anxiety leads to insomnia, or both. And the next one is panic attacks. Panic attacks produce an intense, overwhelming sensation of fear that can be debilitating. During a panic attack, a person may also experience rapid heartbeat, sweating, shaking, shortness of breath, chest tightness, and nausea. Panic attacks can happen as isolated occurrences, but they may be a sign of panic disorder if they occur frequently and unexpectedly. And the last symptoms is avoiding social situations. You may be showing signs of social anxiety disorder if you find yourself first feeling anxious or fearful about upcoming social situations. And second, worried you may be judged or scrutinized by others. And the third one, fearful of being embarrassed or humiliated in front of others. And the last one, avoiding certain social events because of these fears.
Anxiety disorders could affect a person's life. Some of the anxiety disorders effects were disturbing the central nervous system, increasing the risk of cardiovascular disease, causing digestion problems, weakens the body's immune system, and also could causing breathing problems. Next. Okay, we can break down the point. Number one, disrupts the central nervous system. The long-term anxiety and panic attacks that people with anxiety disorders usually experience can cause the brain to release hormones on a regular basis. This condition increases the frequency of symptoms such as headache, dizziness, and depression. Number two, increasing the risk of cardiovascular disease. Anxiety disorder can cause an increased heart rate, palpitation, and chest pain. Anxiety disorder can increase the risk of coronary heart disease. Next. Number three, causing digestive problem. Anxiety can also affect the excretory and digestive system. When you feel anxious, you may experience stomach pain, nausea, and other digestive problems. And number four, weakens the body's immune system. Anxiety could trigger a stress response and release lots of chemical and hormones such as adrenaline into your body system. This could increase your pulse and breathing rate in short terms and makes it easier for your brain to get more oxygen. This response also prepared you to respond appropriately to intense situations. Moreover, your immune system may also get a brief boost. However, if your anxiety disorder is frequently triggered, your body will never get the signal to return to normal functioning. This can weaken your immune system, making you more susceptible to getting sick and getting infected with virus. Next. Okay, the last one is causing breathing problems. Anxiety disorder can cause breathing to become fast and shallow. If someone has chronic obstructive pulmonary disease or COPD, they are at high risk of being hospitalized for anxiety-related complications. Moreover, anxiety disorder can also worsen asthma symptoms.
Okay, we're gonna talk about the treatment. There are two main treatment for generalized anxiety disorder are psychotherapy and medication. The psychotherapy, also known as talk therapy or psychological counseling. Psychotherapy involves working with a therapist to reduce your anxiety symptoms. Cognitive behavioral therapy is the most effective form of psychotherapy for generalized anxiety disorder. Generally, a short-term treatment, cognitive behavioral therapy focuses on teaching you specific skill or directly manage your worries and help you gradually return to activities you avoided because of anxiety. Through this process, your symptoms improve as you build on your initial success. And then the second one is the medication. Next. Okay, the medication for anxiety disorder often include the first one is anti-anxiety medication such as benzodiazepine may decrease your anxiety, panic, and worry. They work quickly, but you can build up tolerance to them. That makes them less effective over time. The second one is antidepressants, can also help with anxiety disorder. They tweak how your brain uses certain chemicals to improve mood and reduce stress. Antidepressants may take some time to work, so be patient. If you feel like you're ready to stop taking antidepressants, talk to your provider first. And then the last one is beta blocker. Usually used for high blood pressure, can help reduce some of the physical symptoms of anxiety disorder. They can relieve rapid heartbeat, shaking, and trembling. Next.
Okay, now we are at the end of the presentation. Based on the information that we have shared, we conclude that we need to raise awareness about anxiety. So, as we explained earlier, anxiety problems are caused by many factors. However, this anxiety can be removed or cured with some appropriate medication so that we are not confused to overcome if anxiety arises. So, come on, be more awareness of anxiety disorders and pay attention to and support our friends who have anxiety disorders.
Okay, let me review the main points. We already know the anxiety and fear felt when experiencing anxiety disorders can make sufferers experience cycle reactions, and interfere with daily activities. Individuals who have been traumatized, abused, or witnessed a traumatic event in their childhood are prone to developing anxiety disorder. Anxiety disorder can affect a person's life and have common symptoms of death. There are two main treatments to cure anxiety disorder, which is psychotherapy, also known as talk therapy or psychological counseling, and medications such as benzodiazepines and antidepressants. Next. Okay, that's all for us. Thank you for listening. In closing, we quote the words of Roberto. He said, "Trust yourself, you survive a lot, and you'll survive whatever is coming. No amount of anxiety can change the future."